to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome to Ask the Patient Advocate podcast, where we discuss all things related to navigating your health. I am so thrilled to have Hector Ventura here with me today for this episode. In the current age of healthcare, it's so important to have an advocate to help navigate for you and your loved ones. And part of advocating is really having the proper resources to support your diagnosis and management. And Hector and I share the same mission to help people navigate their healthcare challenges. He is a psychotherapist and a certified life coach. He specializes in working with males specifically who struggle with grief, trauma, and imposter syndrome. So today I would like to extend a warm welcome to Hector. I meet a lot of therapists through working as a private patient advocate. And when I first met Hector, I immediately felt welcomed into the conversation with his full attention. And I think that is so important when you are searching for someone with a specialty like Hector's. And his caring and intriguing personality was immediately evident. And I'm so excited to have him join us today. So welcome. How are you doing today?
Doing good. Thanks for having me.
Of course. Well, Hector, can you start maybe by telling myself and our listeners a bit about yourself and your background as a psychotherapist and consultant?
Yeah. So, for starters, I'm the son of Salvadorian immigrants, born in New Orleans, raised in Houston. I did my master's in social work at UTA, University of Texas, at Arlington in the Dallas-Fort Worth area. I've been in the field since 2015. I'd say, the majority of my career as a mental health professional has been here in Florida. So, I got into private practice when I found out I was going to be a father in 2021. And here we are. Came to Florida with no kids. Now I'm married and have two baby girls, and I love what I do. And I really appreciate the opportunity of just being here and being able to chat a little bit with you about mental health.
That's amazing. Thank you for that introduction. I have two kids as well, and it's amazing how being a parent has given me like a different, I guess, outlook or another outlook on pretty much every topic or whatnot. And I also think back a lot of times because I remember always feeling like so busy before I had kids. And now I always think like I had so much time before
Yeah.
like what did I do with my extra time, so it's interesting how that works, but it's definitely a great experience of I feel it's just it's also very time consuming and exhausting to be a parent, but I think it's definitely rewarding as well.
Definitely.
So what inspired you to specialize in assisting people with specifically with your services? Like what made you go into it?
Yeah, so I'd say that throughout my life, there's been key people that have been unconditional with the way that they've supported me. And just seeing how other people have been there for me in my life led me to make a decision that I want to be in a profession where I can help people. And here we are, right?
Yeah.
So definitely just looking back, I'd say that's been like the key thing in terms of just making that choice to work as a mental health professional.
That's wonderful. And in your experience, what are some of the most common barriers that your clients encounter when they're trying to communicate, or people in general encounter when trying to communicate their emotions effectively?
Yeah, I'd say something that I encounter is that sometimes people know in a general sense that they feel maybe sad, right, or anxious, but maybe they don't know necessarily how to verbalize that. So for me, I'd say it's just maybe having the language, right, to be able to express themselves adequately. So for me, that's something that I really strive to do whenever I work with people is uh, engaging in this exploratory conversation where people can develop more awareness about the connection between their thoughts, emotions, and behaviors. So that's what I strive to do, right? Easier said than done, but
Yeah.
definitely, empathy is super important to do that.
No, I think that's very important, and I think that's something that people struggle to do, and you kind of need someone to guide you into that process because you don't think about it before. I remember talking to a therapist years back, and they had like asked me, we shared something, and they'd be like, "Well, how does that make you feel?" And I like didn't even know how to answer it because I never thought about it, right? I never like processed that, and they're like, "But what does that mean?" Like I didn't even I think people don't really take the time to like understand or know how to like even process or think about their emotions and like that. So I think it's so important to see that aspect of it and to have someone coach you through it. So I think that's wonderful that you're able to do that.
Definitely, definitely.
And then, how would you say that you customize your approach to meet the unique needs of each individual client, considering that everyone has their own communication style and, of course, their own barriers and challenges?
Yeah, good question. So for me, I'd say that regardless of the approach that a therapist can use with a client, empathy, like I mentioned earlier, is key. Trying to see where the person is coming from, trying to level with them, validate how they feel. So I'd say empathy is key, right, to be able to engage in conversation. But aside from that, I use a solution focused approach in therapy. Um, I'm trained in other approaches, but what I like about solution focused therapy is that I get to focus on the things that matter the most to clients. So
Oh, I love
yeah, yeah. So, for example, the first session, I'll ask people about what brings them to therapy, and I'll ask them about, ideally, in a perfect world, what kind of changes would you like to see? Questions like that, very open-ended questions. It may sound a little bit maybe abstract, but it's a way for people to think about what is it that I want, and then talk about, barriers and maybe the pathways to get to where they want.
No, I love that. That's amazing. I think that's so important. And how do you say you would gauge your progress with your clients in improving their emotional communication skills? Are there specific markers or indicators? And I asked that question. I think it's kind of a tricky question, but or a specific question, but I think that when people are maybe considering, like, hey, do I need to reach out and make this appointment, and they're a little hesitant, I think that sometimes that goes on, those questions go on in their head where it's like, well, how will I know if I'm improving and things like that?
Yeah. So I'd say, in a general sense, I like to use measurement based care, using measures like PHQ-9 for depression and the GAT-7 for anxiety. And there's a lot of programs out there that will incorporate data analytics. So they'll like graph, right? A client scores across time. So that helps to see, one side of things. In terms of communication, there's a specific framework that I like to use from Dr. David Burns, pretty well known psychiatrist. He has a communication framework that's called EAR. So it stands for empathy, assertiveness, and respect. And it's a way for me to engage with clients. And regardless of the type of relationship, whether it's personal, professional, or romantic, I like to use that framework as a way to engage with people to see, how are you doing with empathy, assertiveness, and respect in that relationship. And there's other tools incorporates with this framework, like the relationship journal, which is an exercise where people can actually assess how they're communicating with another person and look at how they did with those different elements: empathy, assertiveness, and respect, and think about how they can make adjustments in how they communicate with people using that framework. So those are just some of the things that I like to do. But yeah, I'm a big fan of the framework.
No, that's wonderful. Those all sound like great, really great tools and measures and methods that you use for sure. So, for individuals who may be struggling with expressing their emotions, what advice or tips would you offer to, let's say, help them start the journey toward a better life?
Yeah, so when it comes to struggling with just expressing yourself, I'd say just challenging yourself to be more open, right, with the people that you care about. Obviously, you don't want to just open up to anyone, but if there's people in your circle that you feel safe with, challenging yourself to start to try and put yourself out there, step out of your comfort zone a little bit when it comes to sharing things that you're dealing with. Obviously, it just depends on how you feel about your circle. Outside of that, I'm a big advocate of journaling. Journaling is a good way for people to develop self awareness about the things that maybe trigger them throughout the day, or maybe a way for people to take note of the things that they're grateful for and appreciate throughout the day. And it's a way for you to start to make correlations between just situations and experiences, right? And how that affects you emotionally, so that you can start to have, I guess you could say, more emotional vocabulary, right? To express yourself, to identify just some of these things that are making a difference in your mental health for better or for worse.
Oh, I love that. That's wonderful. Now, what type of clients do you work with, and do you accept insurance? Do you provide in person or virtual? Like, how do people how would they connect with you, or, if they wanted to book an appointment?
Yeah. So for me, I I'd say primarily work with men. That's my niche, men's mental health,
Mhm.
and Spanish speakers, just in general. As I mentioned, son of Salvadorian immigrants. Um, Spanish is my first language.
It's wonderful.
Yeah, I'd say for me, that's those are like the main populations that I work with. I'll work with, I'd say, with anyone, right? It doesn't just have to be like men or Spanish speakers, but I'd say, given just like my passions and definitely with just some of my marketing, I'd say those are the populations that I work with the most. In terms of insurance, I do accept a lot of the mainstream insurance plans like Aetna, Cigna, United, Florida Blue, which is the Blue Cross Blue Shield plan here in Florida. And aside from psychotherapy, I do also provide immigration evaluations for people, for example, that are going through an asylum case or a hardship case. Those are specific clients that are usually referred to me by attorneys. So that's a different type of niche, but that's also something else that I do within my practice.
And that, is it specifically in Florida, or could it be throughout the US because it's more of a consulting type thing?
Yeah, so that's something that I do with clients that reside in states where I'm licensed. So I'm licensed in Florida, Texas, Virginia, Connecticut, Utah, and I might be looking at some other states in the near future. But for right now, that's where I'm licensed, and that's where I can provide not just therapy but also the immigration evaluations.
Oh, wonderful. That's perfect. That's great. That's great that there you are licensed in so many states. That's perfect. And then what is the best way to schedule an appointment with you? Like, is it via your website, or to just call, or what how would they do that, or what's the best way?
Definitely. So you can always go to my website, ariseconnections.org.
Mhm.
And when you go to the services page, you'll see there a button that allows people to book now, right? It literally says book now. So you just click on it. You could self schedule. You can also call our business line, 727-591-4127, or reach out by email, info@ariseconnections.org. So we like to have just multiple points of contact, right? Make ourselves accessible to people. So those would be like the main ways, right, that people can reach out. And we're also on Psychology Today, and some of the other like therapy directories as well, where you can find our info.
And then you do virtual visits, correct? Perfect. That's wonderful. I think, that makes it more accessible, you more accessible to people, and then their schedules, more available to meet with you. So that's perfect. I'm all about virtual visits. I think that's such a great technology to use.
Definitely, especially with two baby girls, so it makes it a lot easier.
Yes, understandable, understandable. No, I think more and more I'm seeing that telemedicine virtual care tool being used, and I love it. I use it every day as well in my practice, and I think it's such a great tool that we didn't really know about and routinely use just a few years ago. Anything else that you perhaps wanted to tell our listeners that I didn't ask you? I know I asked you a lot of questions, but is there anything I missed?
Yeah, I'd say something else that I like to tell people whenever I have a chance to do a podcast or even just one-on-one with clients is is just be an advocate for mental health, especially when it comes to men, because there's a lot of stereotypes about mental health in general, and then just about men, right? Like men have to be strong, men shouldn't cry, et cetera, et cetera. So for me, I'm all about breaking the stigma. I'd say yes, resilience is important, right? Because life is tough, and and sometimes uh, you don't have a lot of options when it comes to how you can move forward with a particular problem. But that doesn't mean that you don't uh, deserve, right, to talk to someone, to get help, or that your concerns don't matter, or that you as a person don't matter. So that's something that I'm also really big on, just trying to break that stigma when it comes to mental health, specifically when it comes to men.
Oh, I love that. I think that's so important, and you don't hear enough of that, so I think that's wonderful. Well, thank you so much, Hector, and thank you everyone for tuning in. And if you're looking for a patient advocate or curious how we can help or want to know more about how to reach Hector, please feel free to give us a call, 947-517-8395. And thank you so much, Hector. It's been a pleasure, and have a great day.
Thank you. You too.
All right, until next time, guys. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.